All right, so if you have been diagnosed with knee valgus, which is a condition where your knee tends to go inward, that could be associated with some weakness in specific muscles in your hip. So there is a nice way to start activating those muscles. It's not related to strengthening, but it's more related to activating the muscles. So it's like the very first exercise that you have to do before going into higher demanding activities or weight. So the first thing is, the name of the exercise is called pelvic drop. And what Dave is going to show you is how pretty much it's done. You can be on a step, just like the one that he's using right now. And he's going to try to keep his pelvis level at some point. And then when he's ready, he's going to keep that knee straight. And he's going to leave or let that pelvis to drop down just a tiny bit. You don't have to go all the way down to the floor. If you just break that level into a drop position, it's good enough. And then you just go up. And that's a nice way to actually start activating the gluteus medius muscle that is on the extend side of the leg, all right? Now, studies have shown that there is a nicer way to better activate that muscle if you are have been diagnosed with knee valgus, or if you tend to have that knee inward when you're, for example, going up and down the stairs, or if you're squatting. And I'll show you really fast how you can do it. Right now I'm helping him to do it, but you can have a elastic band like this one. You don't need a strong one. You can do it with a very light one. And what you're going to do is you're going to set it around your pelvis, just like this. Okay, you can do a little knot here. And you can tie this end to a rail or a doorknob, but the idea is to have a force that will try to rotate your body to the side that is on the air, okay? So I'm gonna tie Davey a little bit stronger here, and I'm gonna ask him to be on the initial position, and I'm gonna ask him to keep his pelvis level, not letting the pelvis to be rotated. Sometimes what we do, we can ask our patients to have their pelvis always in somehow contact with the bar, while with this hand I'm exerting a external force to try to externally rotate that hip. Okay, so again, you can be having this on a rail, so it keeps you with that momentum of rotation, and you're going to try to resist that as much as you can while you're performing the hip drop or pelvic drop exercise. All right, so we're going to do a few of this. 2, 3, all right, and rest. And you don't need to do 20 repetitions. You can do 3 repetitions, and we always recommend to do it bilateral. That means you start on one side and then you move to the other side and repeat. And again, the idea is to have that muscle with a better activation so it can respond better to any external forces.